Ibandronate sodium, also known as ibandronate, is used to prevent and treat certain types of bone loss, known as osteoporosis. Osteoporosis causes bones to become thinner and break more easily, and the risk of developing it increases after menopause, as you age, or if you take corticosteroid medications for long periods. This medication works by slowing bone loss, helping to maintain strong bones and reduce the risk of fractures. Ibandronate sodium belongs to a class of medications called bisphosphonates. When taking ibandronate sodium, it is important to follow the recommended daily dosage and the optimal timing for taking it to achieve the best results. Before taking ibandronate, be sure to read the medication guide and, if available, the patient information leaflet provided by your pharmacist. It's important to follow the instructions closely in order to absorb as much of the drug as possible and reduce the risk of injury to your esophagus. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth as directed by your doctor, usually once a month on the same date each month. Choose the day of the month that best fits your schedule. Take this medication after getting up for the day, and at least 60 minutes before taking your first food, beverage, or other medication. Do not take it at bedtime or while you are still in bed. When taking ibandronate, be sure to drink a full glass, 6 to 8 ounces / 180 to 240 milliliters, of plain water. Do not take it with any other beverages, and do not chew or suck the tablet, but swallow it whole. After taking the medication, stay fully upright, sitting, standing, or walking, for at least 60 minutes and do not lie down until after your first food of the day. Wait at least 60 minutes after taking ibandronate before you eat or drink anything other than plain water and before taking any other medication by mouth. It's important to note that certain medications and substances may interfere with the absorption of ibandronate, such as quinapril, certain forms of didanosine, sucralfate, bismuth subsalicylate, calcium or iron supplements, vitamins with minerals, antacids containing calcium, magnesium or aluminum, as well as foods such as dairy products, mineral water, and calcium-enriched juice. Do not take these products for at least 60 minutes after taking ibandronate. Remember to take ibandronate regularly on the same day each month to get the most benefit from it. It may help to mark your calendar with a reminder. Talk to your doctor about the risks and benefits of long-term use of this medication, and continue to take other medications for your condition as directed by your doctor. If you experience stomach upset, diarrhea, pain in the arms or legs, or mild flu-like symptoms such as tiredness or muscle ache, it's important to consult your doctor. It's crucial to remember that this medication has been prescribed because the benefit to you is greater than the risk of side effects. However, it's important to seek medical attention if you experience increased or severe bone, joint, or muscle pain, new or unusual hip, thigh, or groin pain, jaw pain, or vision changes. This medication may rarely cause irritation and ulcers in your stomach or esophagus, so it's important to get medical help right away if you experience new, severe, or worsening heartburn, chest pain, difficult or painful swallowing, severe stomach or abdominal pain, black or tarry stools, or vomit that looks like coffee grounds. In the rare event of a serious allergic reaction, seek medical help immediately if you notice any symptoms such as rash, itching or swelling, severe dizziness, or trouble breathing. If you experience any other effects, it's important to contact your doctor or pharmacist for medical advice. Before taking ibandronate, it's important to let your doctor know if you have any allergies, especially to other bisphosphonates. This medication may also contain inactive ingredients that could cause allergic reactions, so talk to your pharmacist for more details. Before using ibandronate, make sure to inform your doctor about your medical history, especially if you have any issues with your esophagus, low blood calcium levels, or kidney disease. It's also important to note that some people taking ibandronate may experience serious jawbone problems, so your doctor should check your mouth before starting this medication. Be sure to also inform your dentist before any dental work. If you are planning to have surgery, especially dental procedures, be sure to let your doctor and dentist know about all the medications and products you are using. They may advise you to stop taking ibandronate before the surgery. If you are pregnant or planning to become pregnant, it's important to discuss the risks and benefits of using ibandronate with your doctor, as it may stay in your body for many years. It is also unknown if this drug passes into breast milk, so consult your doctor before breastfeeding. It's important to be aware of potential drug interactions, as they can affect how your medications work and increase your risk for serious side effects. Keep a list of all the products you use and share it with your doctor and pharmacist. Also, be mindful that ibandronate sodium may interfere with certain lab tests, so it's important to inform lab personnel and your doctors about your use of this drug. If you or someone else has taken too much ibandronate sodium and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the US, you can call 911 or reach out to your local poison control center at 1-800-222-1222. Canadian residents can contact their provincial poison control center for assistance. It's crucial to act quickly in these situations to get the necessary help. Do not share this medication with others. To promote healthy bones, it is recommended to increase weight-bearing exercise, quit smoking, limit alcohol intake, and consume well-balanced meals that contain enough calcium and vitamin D. You may also need to take calcium and vitamin D supplements and make lifestyle changes. Consult your doctor for specific advice. While taking this medication, it is important to undergo lab and/or medical tests, such as bone density tests, X-rays, height measurements, and blood mineral level checks. It is essential to keep all medical and lab appointments. Consult your doctor for more details. If you forget to take a dose of ibandronate sodium and your next scheduled dose is more than 7 days away, do not take the missed dose later in the day. Take it the next morning after you remember, and then continue taking your monthly dose in the morning on your originally chosen day of the month. If your next scheduled dose is only 1 to 7 days away, wait until your selected day to take the medication. Do not take 2 tablets within the same week to catch up. If you have any questions, consult your doctor or pharmacist. When it comes to storing ibandronate sodium, it's important to keep it at room temperature and away from light and moisture. Make sure not to store it in the bathroom, and always keep it out of reach of children and pets. It's important to properly discard this medication when it is expired or no longer needed, and remember not to flush it down the toilet or pour it into a drain unless instructed to do so. If you're unsure about how to dispose of it, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.